Um, this segment will be recorded, um, but Black Mamas ATX helps provide doula support for Black mothers here locally and helps provide maternal health kits afterwards. But I'll let Kelenne give a little bit more information about that. Um, the only other thing that I would like to say is that IBEW has had electricians trying to support in this mission specifically, and it's a charity that's very close to my heart. So I'm glad to have her here visiting with us, and I'd like to yield the floor to Kalene.
Hi. Thank you, everyone. Good afternoon, evening, depending on where you are. It is so good to be here, Toga. Thank you so much for inviting me. I love to see this amazing work happening all across the nation and so many people mobilizing for maternal health and reproductive justice. It really, it is great to know that we are not in this work alone. And I know that because of folks like Toga and the rest of the team showing up when we need them. We're never in this work alone. So thank you. I'm going to, if it's possible, to share my screen. If whoever's in charge of sharing screen could let me do so. I have a presentation that I will do. Hopefully, I won't go too long. Feel free to stop me. Um,
Let me,
Let me
yeah,
know. Yes.
great.
Confirmed.
Perfect. Thank you. Like I said, I am with an organization called Black Mamas ATX. We are a small nonprofit in Austin, Texas. We serve the Austin five-county metro area. So that's Travis County, Hayes, Williamson, Bastrop, and Caldwell counties. And these are Texas counties, so Texas-sized counties. A lot of surface to cover. But what we do is we provide culturally aligned, client-centered birth and mental health services to Black birthing people in the Central Texas area. Our organization came about in 2018 as a community-based response to the Black maternal health disparities that our community has been facing. That is persistent and um, I say community-based approach because health disparities are systemic issues, right? Structural issues, large issues that are very multifactorial. Um, and as community members, we are doing the things that we can to address it. What from an individual standpoint, in supporting individual mothers and birthing folks, but also from a community building standpoint and hoping to push for change at the structural level as well. So what we do, the core of our work at Black Mamas ATX is our doula program. And the doula program offers holistic support and childbirth education, which includes prenatal, labor, birth, and 1 year postpartum of support. We begin meeting with clients. Our doulas begin meeting with clients in their first or second trimester, so early in their pregnancy, to give a lot of time to educate and prepare for the birth. Um, and then our doulas attend the births, and they can attend the births anywhere. Wherever the birthing person is giving birth, the doula will go there. So it could be in the hospital, which are most of the births. It could be at a birth center, or it could even be if the person's doing a home birth, the doula will go to them. Uh, and we continue supporting clients up to 12 months postpartum. By that time, they're not necessarily needing the everyday doula support, but they have access to their doula if they have questions, they need resources, anything like that. And so that is still the core of our service. That's what we started with as our community-based way to say, hey, let's see how we can help Black mothers here in Central Texas, where we are, to survive and thrive. On top of the doula support, we do social support and wellness in various ways, wraparound support. We have a mental health program where we've teamed up with Black and Brown mental health experts in the Central Texas area, and they are able to offer clients individual therapy. This is really valuable for folks dealing with postpartum depression, of course, but also trauma, either, trauma before the birth or birth trauma from the birth experience, or all the anxiety and the many things that people deal with in pregnancy, birth, and from the chronic stress of experiencing life as a Black woman in America and in the world today. And so that mental health support is really valuable, and it is free to the clients. We have monthly workshops where our doulas provide education. It's not just for clients. We open it up to the wider community because, yes, our doulas do great work one-to-one, but it's great to be able to support people who we can't directly help at in the same level, right? So we open up those workshops. They're free and donation based for anyone who wants to attend. We have a lactation workshop coming up next week. If you know anyone who's pregnant and might be interested in nursing, please share our information. We have a sister circle community. We have specialized support groups. One is called Soothe Your Nerves Anxiety Support Group. We also have a monthly mamas support group for pregnant and postpartum folks. We have that wraparound support. So if mom's having trouble uh, with paying a bill, paying electricity, and we are able to step in and pay bills, pay some utility bills. Occasionally, we can help with rent support, or if not, we have someone on our team who can help with resource navigation so they can get the support they need from other organizations that provide it. And so that wraparound support is making sure that it's not, you know, there are the social elements of health, social determinants of health, and that those aren't being neglected. Community building events. We have mamas meetups, go trek walks. Austin, Texas is continually being gentrified in the sense that a lot of the families who have Black families in particular who have been in Austin for generations have been displaced and are no longer able to afford living in the city or have been pushed out of the East Side, which traditionally was where the Black community lived after the city pushed them all to that area during segregation. And so one of the ways we are trying to help Black moms build community is meeting other Black moms and trying to get that social support because it's important to health. Another thing that we focus on would be our advocacy and community engagement. So it's a systemic issue, right? Part of addressing it is trying to change the system, trying to push the system. And that could be in the form we've done rallies in the past at the Capitol. We have been involved in education around bills and legislation that can improve maternal health in Texas. We've done Hill Days both in Texas and DC. We have we have an annual summit, which it wasn't annual until last year. It was every so often we had this summit. We launched with a summit in 2018 and we'd have it every so often. But as of last year, it is now annual and we hosted during Black Maternal Health Week, April 11th to 17th. And it is open to everyone. It's partially in person on one day, and then the rest of it is online. So wherever you are in the country, if you want to be involved, please keep an eye out for our summit. Now, why do we do all of this? Like I said, we came about because of the maternal health disparities that the Black community faces. Black mothers and birth givers are 2.5 times more likely to die as a result of pregnancy and childbirth than any of our counterparts of any other race or ethnicity in Texas. And those are the Texas numbers, but as you all likely know, since you are in this group, this disparity is persistent throughout the entire country, the entire United States of America. So wherever you are, the number may not be the exact same, but Black women are dying at higher numbers disproportionately through pregnancy and childbirth, and that needs to be addressed. And on the flip side, Black infant mortality is 2 times higher in Texas as well. And so if you support the moms, you support the babies, hopefully just starting at the beginning will improve the situation for everyone. 80% of all maternal mortality is preventable, according to the Texas Department of Health and Human Services. And so knowing all this, our doula support is intended to help with that preventing. Black women are terrified of being mistreated. That is something clients come to us for and consistently share their fears and concerns. And having a doula is something that helps improve their sense of safety. This is my team. These are the administrative staff. And here we have our amazing doulas and our doubro, which is a cool thing that we added. So we have our 4 sister doulas, and we have a doubro who is a doula for the dads, because we realized that the fathers are also playing a key role at birth, in postpartum, in all of this. And having dads who are also prepared and can also advocate and support and provide that extra helping hand is a game changer. So William is a postpartum trained doula, as well as fatherhood specialist and newborn care specialist. So he is our doubro who works with the dads, or the partners of our clients who are pregnant. And last on the screen is Khadijah, who's our wraparound support specialist. So, for those who might not know, a doula is a trained non-medical professional who provides continuous physical, emotional, and informational support to their clients before, during, and for birth doulas shortly after childbirth to help them achieve the healthiest, most satisfying experience possible. Community doula work is a little more in-depth, and like I said, our doulas go through 1 year postpartum. Our impact. So far, we have supported over 300 births with free doula support. We have never charged for our doula support. Over 900 prenatal doula visits have happened over the years, over 1,000 postpartum doula visits. Our breastfeeding initiation rate is 90%, which is higher compared to the typical United States breastfeeding initiation rate for African Americans, which is 74.5%. And our Sister Circle community is a digital community that has over 500 members on our newsletter. And the reason we choose doula support during the perinatal period is associated with reduced C-sections, reduced premature delivery, reduced length of labor, anxiety and stress, and improved the breastfeeding success. And so in our work, we want to be able to allow Black mamas to benefit from those positive results of doula support. And that's why it is and continues to be free for anyone who is Black and pregnant in the Austin 5-county metro area to receive a doula with our organization. As long as we have space for them, we can plug them in. Here's my contact information. Please keep in touch with Black Mamas ATX. And if you'd like to volunteer, if it's an online volunteering activity, we don't have a lot of volunteering activities, but occasionally we might have events, fundraisers, or just needs. And so feel free to sign up to volunteer, feel free to donate. We are a nonprofit and we continue to make our efforts free. So with that, I will stop sharing. Thank you, everyone.